all this transformation must be physician-led, professionally run. And so partnering with our physicians, our faculty here, is one of the hallmarks of this institution because we do everything together. As a CEO, I have to lead this organization through all this and constantly reinforce the work that we do and the training that they get. My most important role is appreciation, is to walk the inpatient units, the outpatient clinics with faculty and so forth and express my appreciation every day for the things they do to care for our children.
I'm Neetza Lawless, partner at Senn Delaney, and I lead our healthcare practice. Senn Delaney is a culture-shaping firm, and we have focused exclusively on that for over 35 years. As a firm, our purpose is to positively impact the world by inspiring leaders to create thriving organizational cultures. For me personally and for many members of our team, we are particularly passionate about helping and working with those who serve the health of people around the country. We have a special soft spot in our heart for those who care for children. So it is with great pleasure that I welcome and introduce Rich Cordova, President and Chief Executive Officer of Children's Hospital Los Angeles, who is here with us today to share their story. Rich, thank you so much for being here.
No, it's my pleasure, and thank you for having me.
Thank you. Please tell us a little bit about Children's Hospital Los Angeles and why you began the journey of culture shaping.
First, what I'd like to share with you is our thanks to Senn Delaney and your team for the wonderful work and teamwork we've had together for the past few years. Children's Hospital is one of those special institutions. We are what we characterize as a freestanding pediatric academic medical center with a mission that includes the prestigious clinical care that we provide, research and teaching. Our affiliation with the Keck School of Medicine at USC strengthens our presence here in the community. So we are one of those institutions that is probably ranked one of the highest in the nation. And we're very proud of our accomplishments over time.
Yeah.
I'm going to take us back to about year 2000 when the board of directors of this hospital decided to embark on building a replacement facility. And the fundraising associated with that was phenomenal. As we got closer to the opening, about a year and a half, we began to realize that we had a gem on our hands. We had the opportunity really to broaden the scope of services that we provided in the past, plus the fact that we had a number of things we had to change in the way we delivered care in this new facility. And so we embarked on the journey with Senn Delaney to really kind of transform the culture, although the bedside culture is something that I thought was the best. The teamwork at the bedside was phenomenal between physicians, nurses, therapists, and so forth. And we didn't want to touch that, but everybody else around us, around the team, was important. They all gathered and said, we need to kind of look at ourselves and say, now that we're going to reach out to different communities, this whole new notion of service to our communities was a priority that we needed to embark on. So that's how we started the journey.
How did the culture shaping actually help you when you opened the new hospital or help you prepare for the opening?
I can tell you the results. They were phenomenal because the teamwork that was involved in actually moving that day, we had a whole schedule. The teams worked together. We had a whole schedule of timing how every patient was supposed to be transferred from the old hospital to the new hospital. And it was like clockwork. We had a lot of fun that day, and I attribute that to the work that we're doing with Senn Delaney.
Rich, tell us how culture shaping has helped you and the organization better prepare for healthcare reform and other changes in the industry.
Well, under healthcare reform, there are so many aspects to healthcare reform that's going to have an impact on our institution. So I'll start first with reimbursement and how the hospital is going to be reimbursed. And while we reimbursed on a fee-for-service basis, where we got reimbursed for everything that we provided, it's going to be more of a reimbursement based on, let's say, a bundle or a capitation, something that's going to incent us differently than in the past.
And how do people have to behave and work together differently to help you be successful at that?
The first challenge is education, educating physicians, nurses, everyone on the team that the way we treat our patients is going to have to change. The transformation of the care, reducing the average length of stay to live within a DRG, a diagnostic related group, which is a bundled reimbursement. All that change takes place on the inpatient services. That educational process for us this time around was very easy. The team caught on. The communications were there. We had champions. We picked up on the champions for our culture transformation and made champions for clinical documentation and clinical operations improvement. And those champions just carried on their current roles and transferred it right into initiatives that we need to get ready for healthcare reform.
Tell us about how culture shaping helped the mindset, the readiness, their openness.
Well, there's a lot of things that we've done over time to prepare our staff. And I think the one thing that I appreciate the most is the annual meeting of all of our managers, directors, and vice presidents, where we have a chance to express as leaders of the organization, and I think that's probably the most important thing, is top leadership, appreciating all the staff, all the physicians of what they do, and recognizing and giving them information about the future. And we just finished our annual meeting about 3 days ago, so this is fresh in my mind. Very exciting time, very energetic time. But they were able to understand why we have to do it. The most important question to answer as leaders, to communicate the why we have to do the things that we have to do, let's say under healthcare reform or some initiative that may be launched. So all the work that we do about the mood elevator, being curious, listening, leading organizations are all the pieces. Because what I've learned through this effort is that we can have a wonderful strategy and we can organize ourselves around that. But if the culture is not ready, it'll eat that strategy 7 days out of the week.
Tell us about how you brought your leadership team together. You've got research, clinical folks, academic, administrative, physician leaders. Tell us about how you worked with them in this culture shaping process.
Well, we're fortunate because we're an academic medical center, so our physicians are pretty much here full time. And we have 5 department heads, from pediatrics to surgery to anesthesia to imaging, radiology, and pathology clinical lab. And so those 5 leaders, physician leaders, are so important to the success of a program like this. You start with that. Plus with our vice presidents and our chief operating officer, that's the team. That's what we call our executive leadership team. We took them away for an all-day retreat. Actually, that took about 2 to 3 days to get indoctrinated, and it was a wonderful experience. I think as a CEO, the first reaction you get is we don't have time to go away for 3 days to have a retreat to talk about leadership. My point was we have to go away for 3 days because it's about leadership, and the transformation that we have to go through is our challenge as leaders to get this whole organization through that. So bringing them together, I can't tell you the energy at the end of those 2 days or 3 days that we had, and they bought in. Then the next question is, how do you take it down layer and layer of the organization? And we created the education and started down the process. It takes a good year to 2 years to get to every employee. And now it's part of our orientation for every new employee to go through.
What advice would you give to other CEOs?
Well, you know, it's quite fascinating to begin walking through the institution and having employees come to you and say to you that I just went through training and it was the greatest experience that I've ever had in my work environment. You begin to realize that you're on the right track and you're doing the right thing. You also learn that it's you. As a CEO, I have to lead this organization through all this and constantly reinforce the work that we do and the training that they get. Probably my most important role is appreciation, is to walk the inpatient units, the outpatient clinics with faculty and so forth and express my appreciation every day for the things they do to care for our children. And it's worked because we've gone through this. A lot of the changes that we're going through right now, a lot easier than if we didn't go through this process. Many physicians are pretty wedded to the way they've been practicing for years, especially community physicians. Here at Children's Hospital, since we're an academic medical center, most of the doctors here have faculty appointments at the Keck School of Medicine and are stationed here. They do their inpatient work, they do their outpatient work, many of them do research, okay? So as we transform the hospital operation, that's one set of work that we're doing. And through cultural transformation, we call it I Transform, is that the ease of which we're doing that. We've got champions that are working on these issues about internal to operations. That seems to be working well. As you think about how we have to restructure the total care of a patient, both inpatient, outpatient, home health, prevention, wellness programs, now we have to go outside the walls of the hospital. And for the first time, we're talking to community pediatricians. What we've found is that through the work that we've been doing with our transformation and our culture, they're beginning to see us differently. Their access to our specialists is different. Not only have we changed the culture, but we've changed our service mentality. And now we're providing appointments for their patients. We're returning results to them in appropriate fashion. We're even going to hook up our information technology, our automated record, so they have access out there. We call that the physician portal. And we're working on a patient portal so the family can look at their automated records and look at the results of tests and so forth. So one of the things that we're doing right now is to take the culture of this organization as a hospital and look more broadly as a system, call it the Children's Hospital Health System, that's outside the hospital, doing the primary care and organizing and bringing community physicians into our culture so that they can enjoy some of the fruits of our success also. We're going to hopefully develop a system of care that will include maybe 500 to 600 doctors out in the community in the Los Angeles area. And that's where we'll have region-wide coverage, and then we can be ready for healthcare reform when it comes.
Rich, you've really given a lot of thought to the role that physicians need to play in leadership. How do you see that for the future?
Well, it's going to be very important that the work that we do in transforming the way we provide care and the models of care, the development of clinical protocols to have more effective, more timely care, has to be physician-led. I kind of characterize it as all this transformation must be physician-led, professionally run. And so partnering with our physicians, our faculty here, is one of the hallmarks of this institution because we do everything together. So our physicians, our top department heads, and ourselves are all on the same executive leadership team. And we do everything. We strategize together, we budget everything together, and that's where integration and alignment is so important. I think if you look at the success of many organizations in healthcare, it's the alignment of physicians, administration, of the organization, and the strategies are all done in the same room.
Rich, tell us how you use the culture shaping process to develop the mission and the values of the organization.
What we really did was we started at purpose. Why are we here? Why does Children's Hospital exist, and why do we do the things that we do? And we found that if you start there, developing and going through the process of the mission was a journey that was worthwhile from the standpoint of getting everyone involved. We started with our executive leadership team. We had our previous mission must have been a couple paragraphs long and had every word in the dictionary in it, as always. And we came up with something that resonated with everybody. We create hope and build healthier futures. It resonates with the physicians, with the research community, with our nurses. Everybody can see something in that mission that relates to them and the people and the children that they're treating. We follow that with the process of building the values. We do our best together. And so those things resonated with everybody, and we believe in them and we use them every day. But we started with purpose. And if you start there, you're going to end up with a winning set of mission and values. And it was a wonderful process, and we continued to use it.
You used the culture shaping process really to bring this group together to work on and develop and refine the mission of the organization and the values. Tell us a little bit about how that happened.
Well, here I want to give a lot of credit to Senn Delaney and the work that you did, because without it, we wouldn't have been able to get where we are today. But to develop that mission in our first retreats and start working on it, recognizing that we had to bring more people into the process, taking it down layers in the organization, getting the feedback, and then taking it to our leadership conference of 325 people and vetting it with them and letting them wordsmith it a bit was quite a journey to get to the mission that we have. The vision, same thing. We're doing the same thing, going through that process. But what you end up with is a mission and vision that has been internalized by everybody in the organization. And when you have that, you begin to realize the power that represents. That every aspect of your mission, every aspect of your vision, they believe in. Do you have to do maintenance on it? Absolutely. You have to continue to revisit it, you have to continue to reinforce it, and you have to continue to answer the questions of why to the staff and to the bedside individuals. Healthcare reform has a tendency to want you to revisit it constantly, to say, are we still on track? Are we still on track? But we have a process now, and we just follow the process. It makes it a lot easier.
One of the things that strikes me about your values is how they connect so much to the heart of people in the organization. And I particularly think about one of the values that you and your team created, which is we serve with great care. Tell us about how you refer to the values, use them, reinforce them.
It's something that we take pride in. It's something that is a sign of success. When somebody starts to make a presentation in some meeting and starts off and says, we do our best together, okay? We are stewards of our resources. They quote a value and start off the talk or in the talk with that. And it's very pleasing to hear it reinforced over and over and over again. So, and sometimes you have to have difficult conversations. And when you've gone through a process where people understand the terminology that we now use, okay? For example, we may find a situation where one personality in the meeting is their mood elevator may be in the inappropriate place. Well, now we can call it out and say, how's your mood today? Okay, where are you in the mood elevator? Are you curious? And so it tends to bring everybody back to a level playing field, and we can continue with the conversation. So you get a better outcome of the meetings. You get more out of these meetings than we've had before. I'm very pleased with the use of our values and how we reinforce them just about every day in all the meetings that we have here.
Rich, tell us a little more about the results and how culture shaping has actually helped Children's Hospital.
Well, there's a number of examples that I could express that have been very satisfying to watch on how the culture shaping has really transformed the way we do business. The survey results we get back from our employees are constantly improving. And we always take a look at that and said, you know, there's always room for improvement. So we continue to do that, but things are starting to show some real acceleration. It's really nice to see that.
I understand that as you've received some of these awards and some of this recognition, people have actually commented on the positive culture that you've created. Can you share some examples of that?
Another point of satisfaction, and it's very, very proud of the reaction we get, because you try to measure success within the organization, but also, you know, one way to measure success is how are the community, how are physicians in the community reacting to it, how is my board of directors reacting to it. And over the years, you have different organizations come in to certify, to survey, Joint Commission, the Magnet, and so forth. And the one experience that I think I was most proud of is when the Magnet, when we were going through Magnet designation, and they call you at the end of the survey, about 2 months later, to announce whether or not you're designated. And they get on a conference line, and we must have had 350 people in this room listening in. And this surveyor basically said, you pass, and there's a big cheer. But she went on to tell us that she has never been in an institution that actually exceeded the standards of Magnet, and she attributed it to the culture of the organization. And it was great because my board of directors were in the front row listening to all this. And it was a moment, and you began to realize this is the right thing to do.
How exciting. That makes me feel so proud as well, so it's wonderful to hear that story. Rich, tell us how you see the role of physicians changing and evolving in healthcare.
One of the major initiatives that we've embarked on is our automated medical record on the outpatient side. It tremendously affects the way our clinicians treat our patients, and the processes and the flow of work all had to be redesigned. And I think what the culture transformation work did was it gave us the opportunity to be aligned, to have an easier way of getting alignment quicker and get to the work that has to be done so that we can execute effectively. And sure enough, which we thought was going to be a very challenging time, we went out with waves of clinics. The first 10 clinics went out, the next 20 clinics go out. And we found that while the challenges were there, the ease of which to get through those challenges was a direct result of the culture transformation work that we've been doing. People understand the why. Being optimistic, being a glass half full person, and being energetic about what we're doing, and learning the process, learning the automated medical record, learning how to document on a computer was a challenge, but it's actually needed. So those are the type of examples where I think the results are, we can easily demonstrate that the work that we're doing and the journey that we've been on contributes to the success of our organization.
Thank you. And thank you so much for the partnership that you have given to us. It's just a great honor to work with you, to work with the Children's Hospital team. You have a fabulous team, and we have enjoyed every minute of it. So thank you very much.
Thank you.